Welcome. My name is Maria Riccardi. This evening, I will talk to you about how to face your fears and the healthy ways to cope. I hope you will enjoy this lecture about specific phobias. First, I'll talk to you about phobias. What is a phobia? And I'll give you general information about phobias. I will try to explain how do phobias develop, and most importantly, how do we treat phobias looking at a cognitive behavioral perspective. So do any of these pictures scare you? The fear of insects, the fear of enclosed spaces, the fear of spiders, the fear of heights, or maybe the fear of snakes. Some of you maybe felt to pull away from the screen or to avoid looking at the images presented. Therefore, what is a phobia? Well, there are different types of phobias. Some phobias are related to animals, such as spiders, snakes, insects, dogs. Other phobias are related to natural environment, like heights, storms. They are blood injection injury phobias, and phobias in relation to situation, like being inside a plane or inside an elevator. And there are other phobias. I'll give you some examples to name a few: being scared of choking, of vomiting, or being scared of clowns or balloons. So before we'll talk about phobia specifically, let me talk to you about fear. Fear is a normal and natural emotion. It's our body's signals of perceived danger. It's a kickstart for the flight or the flight response. So fear, it's very natural. It's part of our life, and actually it can save our life. Whereas specific phobias, it's an intense, persistent fear of a specific object or situation. Almost always provokes immediate fear of anxiety. The object or the situation is avoided or endured with intense fear and anxiety. It's out of proportion to actual danger, and it must interfere with our daily life, for example, in social situation, with family members, with friends. I'll give you an example. Being scared of a spider. Maybe we will go on a family camping trip and we'll avoid to go in the garden, and maybe even some outings, and this will make us be away from friends and family. So phobias make our life seems less tasteful. Because of them, we avoid being in certain situations. So how common are phobias? It is the most common anxiety disorders. Approximately 10% of adults have a phobia in their lifetime, and 75% of individuals who have phobias may have multiple specific phobias, an average of 3. It often begins in childhood, and if it is untreated, it tends to be chronic. Research says that females are more affected than males. However, it is unclear if it's due to reporting bias or a true difference. So how do phobias develop? Well, first, it is most likely to develop fears about objects that are related to danger. If you look at these three images, I wouldn't be afraid of a flower, electrical outlet, but I may be afraid of a snake. So in devolution time, if we look at storms, lightnings, snakes, maybe these object or situation were related to danger, for real danger. Now they become part of our phobias. Sometimes a trauma could become a phobia with time, and this is what we call traumatic conditioning. Fear develops after having a direct negative experience with the object or the situation. I'm climbing a mountain, I'm falling down, and then after I'm scared of heights, I'm scared of climbing again. I try to avoid even going trekking or walking around mountains. Could become a phobia with time. There is also observational learning. Fear develops after seeing someone else hurt or afraid of the object or the situation. For example, if as a child I look at my family members and their fear of lightning and storms, I may develop phobias by simply observing the fears in others. And the information transmission. Fear can develop after being warned or told to be fearful of an object or situation. And the news are an example of this transmission of information. So now let's look at why the phobias persist. First, there's an avoidance. If you are afraid of an object or a situation, you will try to avoid it, physically and mentally. I'll give you an example. You're scared, so physically you don't want to go near a situation, but then you're saying, oh, I feel really scared. This makes sense, I'm afraid of the situation. And more we avoid, more this strengthens the desire to escape, and this prevents relearning. This is a wonderful example coming from the Mayo Clinic. If you look at the first image on the top, the situation, the boy sees a dog, and then he's thinking, just the thoughts, this dog is dangerous. It can hurt me. So he avoids the dog, he runs away, go inside his home. In the home, he distracts himself by playing and saying, I'm away, I'm okay now, I'm safe. But as he go back outside, he's still worrying, looking from far to this dog. And the circle starts again and continues. More he avoids the situation, more the fears is heightened. The beliefs are another cause why phobias persist. What you tell yourself about the fear object or the situation. And it's characterized, by danger or threats attached to the situation itself. Looking at this bridge, oh, this bridge is dangerous. I will avoid it. And the reaction, I feel threatened. I feel scared. Therefore, it makes sense the bridge is scary. I won't go on it. And this will keep on the fear. These are often misperceptions. Because bridges usually are not scared, are not dangerous. Sorry. And how do we treat phobias? And that's the heart of the presentation this evening. Well, cognitive behavioral therapy works on the principle that we have thoughts, behaviors, and emotions, and they all relate to one another. For example, my thoughts, what we think affects how we feel and act. So I'm thinking, oh, there's a spider. The spider could be dangerous. I will avoid, so my behaviors are affected. and I will feel uncomfortable, so I feel in comfort. Same thing for emotions. I see the spider. My heart beats fast and I feel very scared inside, and this will affect my behaviors. I won't approach the garden. And my thoughts. That's really creepy. This thing could crawl on me. Same thing for the behaviors. So this is a relation through our body, our mind, and our feelings. And if we look shortly at about cognitive behavioral therapy and the way it's effective in our life, first, it's empirically supported. It's backed by science. It's short term, so it tends to be between 10 and 20 sessions. It's present centered, so the therapist and you will focus on addressing the problem and the symptoms. What I like about CBT is action oriented. We'll teach you techniques and strategies, and you will make changes using them in your life by doing homework and by practicing in real life setting. And you bring back in therapy what you practice, and we continue to help you to work on your fear or anxiety. And it's collaborative. It's client and therapist working together on the same problem. And it becomes like a research team a little bit, where the clients become the expert with time. So CBT for specific phobia targets three main areas. First, for reducing arousal. For that, I'll teach you this evening breathing techniques and relaxation training. Then, cognitive restructuring. This is where you could gather accurate information and you correct your negative biased thinking. And we'll look this evening how this can work. And exposure. This is the heart of how we treat phobias. It's confronting the feared object. So first, reducing physical arousal. It is much more difficult to function and think rationally when anxious. Therefore, relaxation is the exact opposite state of a stress response. When you relax, decrease in heart rate, there's a decrease in blood pressure, in muscle tension, and in the respiration rate. And learning relaxation techniques to cope with anxiety and reduce your fears over time it helps you calm down, it helps you to relax, but most of all, it's a wonderful way to self-care. So these overwhelming feelings slowly tends to go away. Another way that you could use with relaxation is diaphragmatic breathing. An anxious breathing is shallow, rapid, and occurs in the chest, whereas a relaxed breathing is deeper, slower, it comes from the abdomen. So I'll show you quickly where you place your hand on abdomen beneath the rib cage, and you inhale slowly and deeply through the bottom of your lungs so that your hand rises. And after a full breath, you pause, and then you exhale slowly. Allowing your body to let go to the full breath. And you repeat it again and again and again. And you do this when you're calm, not when you're in the difficult situations. You want to practice before, so when something happens in your life, you could use breathing as a strategy to cope. And there is progressive muscle relaxation. So while practicing deep breathing, you ease tension in every part of your body. one muscle group at a time from toes to head. So the active progressive muscle relaxation is when you tense each group for a few seconds, then release the tension while feeling yourself letting go. I'll show you here my hands, but if I really go very strong and I undo it, it feels very good. And you could do it to each muscle group of your body. And there is a passive progressive muscle relaxation. This is when you go through each muscle group and simply relax, release tension, and breathe at the same time by laying down, for example. The second facet for the techniques we'll be looking at is a cognitive restructuring, changing your thinking. Because you must know, but thoughts are not facts. Negative thoughts about perceptions or threat play a major role in maintaining fears. And the negative thoughts are often based on the lack of information or the inaccurate perceptions. So cognitive restructuring, identify and correct this negative thinking. And this will help you as you are practicing. And let me show you how we do this. Step 1. You write down your fearful thoughts about the phobic object or situation or harm caused by your reaction to the situation. So for example, you have a fear of elevators. First, the elevator cable will break. Then you're thinking, I'll be stuck and no one will ever find me. I feel like I can't get enough air, so I might faint. I feel so anxious, therefore I could lose control. These are all the thoughts that comes in my mind. Step 2, you gather accurate information to fill gaps in knowledge and correct misperceptions. How? You read and you consult with experts. And 3, then you look at your thought and you look at your fact. So the second box below will give you the same example. I'll suffocate if this elevator gets stuck. Elevators are dangerous because the cables can snap. But the fact is, there is always ventilation in elevators. They have a backup mechanism. If a cable breaks, the elevator safeties would kick in right away, and I'll be okay. In step 3, identify misperceptions and correct them. And how? Identify thinking errors or distortions. Treat thoughts as hypotheses and test them. So first, identify distortions. So there is overestimation. This is treating negative events as probable when they're in fact unlikely. And I'll give an example of the dog. You assume a dog is dangerous and it will probably attack, when most people know that dogs are not dangerous and most of dogs are not aggressive. That's very different in thinking. And then identify other distortion. Another example, catastrophizing. Viewing an event as dangerous, unbearable, or catastrophic when actually it is not. I'll give you an example of an injection. The pain of an injection is unbearable. It's the worst thing that I can't imagine. It may be not the worst thing that we can imagine. Or spiders are disgusting and I can't stand to even look at them. There may be other things more disgusting. So we're just looking at how you see life or the feared object. Then you treat thoughts as hypotheses and test them, and you examine the evidence. What is evidence? what is evidence that this is dangerous? And what is the evidence that this is safe? And you look at it and you challenge it. And the cognitive restructuring, again, as we said, you treat your thoughts as hypotheses and you test them, and then you find more realistic alternatives by challenging you, by giving you questions. What happened the last time I encountered a spider? I got scared, but nothing happened to me. What is a worst case scenario? That we said before, the elevator might stop, but the cable won't fall down. There will be some mechanism that will hold this elevator in place. So we look at these facts and we try to change the way we think. And this is an example because we may write different idea and hypothesis how much it would happen. So if we look at number 2, the second example, the spiders move quickly. So the initial negative thought is the spider may get on me, but the alternative outcome, it is the spider is maybe afraid of me. It should not come on me, but even if it comes on me, it won't hurt me. And the probability that it comes on me is 5%. This is how we would write the different ways our thoughts are created in the world, and the way when we write them down we realize, oh, there's different ways of thinking. And the last and most important way to decrease phobia is exposure. So repeated and controlled practice with directly confronting the feared object or situation. It's the most effective treatment for phobias. It allows for relearning that the situation is not as dangerous as we thought it was. What I'm worried about will rarely happen, and I can cope with my worry, and it does come down. So step 1, develop an exposure hierarchy. To generate a specific list of situations related to encountering the phobic object or situation, and you rate your level of anxiety if you had to face the situation right now. So 0 to 100. And you organize them from the lowest to the highest hierarchy. That's the first step. Step 2, you write your chart and look at this. Example, I would like to drive my car on the highway, but I'm very scared. I'm fearful about it. First, I may say at the bottom, I'll pull my car from the driveway, and this will give me maybe 30% of fear. I'll drive in a residential neighborhood for maybe 30 minutes. That will give me 40% of fear or anxiety. Then slowly I will climb up. I drive in the city where there is light, traffic. And after I'm able to do this, I'll drive on the highway for 30 minutes with a friend. And slowly I'll go until I'm able to drive alone in the city on a highway with no friends in rush hour. So we'll go from the less feared situation to the most feared. While to practice facing the items on the hierarchy, this recommendation is very important. You have to prepare to feel anxious during exposure and don't fight it. You have to stay anxious. So if you're doing the exercise, driving on your driveway, but you avoid thinking about it, you won't be scared, but it won't decrease your anxiety. You stay in the situation so you can learn feared outcome will not occur. And you repeat, and you space this practice closer together, and you eliminate any destructive behavior or any safety behavior. This is a wonderful chart just to show you if you place yourself in the feared situation, anxiety will rise, but then at the height up there, it will come down by itself. It will just go down. Most people think the anxiety will rise high above. It won't. If you stay in the situation, anxiety will be lessened as time passes by. This is why we're going to ask you to stay in the fear situation to feel it and to feel when it decreases as well. And the different types of exposure, there is a graduated exposure going from least to most difficult items, as we saw before. But there is the intensive exposure. You begin with more difficult items and you move through hierarchy rapidly. There is pros on the intensive exposure. You get over fear sooner and faster. But the cons, it's that more intense discomfort versus when you do it slowly with graduation. So the best approach is yours. Your therapist and you together will discuss how for you is the best way to approach your fear. And there is different type of exposure. The in vivo exposure, so this is the real life exposure, going in the garden and playing with the spiders. And there is as well the imaginal exposure, encountering in one's imagination. While in vivo is preferred because it tends to be better in treatment, but often we'll start by imaginal exposure when in vivo is too intense, to go slowly to bring you in a real life situation, to really practice and experiment. This is how your fear will decrease. So to finish this evening, ensuring your fear doesn't return, keep practicing. Continue with occasional exposure whenever it's possible, even when it went down. Beware of subtle avoidance when you start to avoid things, places, objects, animals, and go beyond what you would normally want to do. If this is fear until now, go a bit higher every time. Challenge yourself. In conclusion, fears are common, normal, and adaptive. Phobias, it's an excessive fear, and it could be very distressing, and it could interfere with your everyday life. And to overcome fear and phobias, you have to become aware of challenging your negative thinking, and you have to use exposure with the feared object or situations. So these are two wonderful books, Mastering Your Fears and Phobias, with Anxiety Phobia Workbook to help you cope with your specific phobias. And I hope you had a wonderful series, a wonderful lecture, and I'll be here another half an hour with you if you have any question to ask me. Have a wonderful evening and thank you.